it's not fun to say it, but it's like you're not going to live a long life. And that's what's frustrating is that people constantly go, well, if I go to the hospital, they go, well, you look fine. And it's like, because I don't have a big scar, and it's like, it's just like, well, yeah, I look fine, but doesn't mean that the inside of me doesn't feel
No,
like
I can
I'm
feel
dying.
it. I feel it on the inside.
Yeah.
I feel it. It's not fine.
Yeah, I can feel the pain going away as you're like, doing the soft tissue work.
Like, I got a really strong hand, and my hands hurt right now. How long has this neck and back been going on for?
So since I was in a car accident in August of 2010. So really, that's what kind of jump started everything.
Okay. Do you have tingling right now?
Right now, it's not so bad. A little bit in the thumb. If I if I go to stretch like that,
Bring your arm
and
back.
hold it for, if I hold it for more than like 10-15 seconds,
Pinches the nerve in your lower
oh,
back.
it'll start going numb.
When you bring
And then the whole arm down, and then sometimes I'll just get shooting pain down my arm.
and that's been going on for since the first accident, or no?
That was going on since this second accident is what really started, and that was in August of 2016. So a year after my jaw surgery, I was coming home from the surgeon's office. They had just cleared me, and I got rear-ended again, and my neck just feels everything feels super compressed. So when I sleep, I roll up like a shirt and like almost kind of try to do like traction. Yeah.
Yeah,
It's if I don't sleep like that, I wake up in horrible pain.
Before addressing anything in here, I want to make sure we're on the same page of we got to get to the source of
No,
problems
I completely agree.
Because the pain management guys are gonna just
Oh yeah, all they can do is just keep me out of the hospital.
right, okay.
Because the hospitals now they can't do anything. So
Right, they don't have the tools. They're not gonna.
Well,
rub your back
and if you go to the hospital, they just treat you like a drug addict, and they go, oh, it's. I mean, I can be literally. I've been in the hospital and had literally gone into shock because I was in so much pain, or had like a, not shock, but I didn't know what it was at the time, but because I have RSD, it was a pain seizure. So the pain level
reflexive sympathetic dystrophy.
Yes. So the pain got so bad that I went into a seizure, and then they gave me pain medication, and then all of a sudden my blood pressure went up and everything went okay.
All right, so we have a massive amount of inflammation in your spinal cord.
Yes.
So we have pressure on your spinal cord. We got inflammation around your spinal column.
Yeah,
and the
and
nerves
then the
exiting.
jaws.
We need to clean you. I want Epsom salt. When we're done here, I want you soaking.
Okay.
This is a process of. It's like going into a room and seeing stains and dirt. Like before we can do any remodeling, I need to clean everything.
Yeah.
And so the stretching is a way of maintaining, but in order to even stretch properly, we got to make sure your whole spine's working. I'm going to go through and try to assess you and examine it while I'm treating you at the same time.
I'll tell you now, flexion is one of the things that causes.
So you mean looking up?
If I look up,
So extension, it's called.
Yeah, extension. Yeah, so if I look up, which that's why I'm not doing it, but
Right.
or jutting my jaw forward,
Understand.
you would know the motion to go and put on mascara.
Yes.
That it's gotten better than it was, but that little motion
Yes.
will it used to literally, so the RSD would make my jaw feel like it's swollen out to here when it's not.
Well, because the posterior structures are all inflamed, when
Yes.
you bring your head back, you're squeezing those posterior structures. So the only way to fix that is to make that area not so inflamed, so therefore
Yeah.
it's not a big deal to bring your head back. It's confronting the problems back there.
Yeah, and something interesting is I do have how do you say it? Gua sha?
Yeah.
A scraper, and I was doing it on my neck, and it's I hit there's a nerve bundle back here on both sides, but when I hit it, it went all down here,
Yeah.
and that was numb for 3 days. All of a sudden the feeling just went out for 3 days. It came back.
How long have you been on pain management total medication for these pains?
Oh gosh, since 2013 really is when they started me, because I was trying to stay out of surgery, but I was having minor jaw surgeries, and then when I had to do a year of orthodontic preparation from 2014 to 2015.
This this path isn't going to end well. I know they want to keep you out of surgery, but the more pain management we do, see, we are allowed, by not feeling our body, we can continue hurting ourselves.
Yeah,
and that's
no, I
part
know.
of why this is growing, is we're disconnecting you from your body.
Yeah.
And now, Ed, it's getting so inflamed that now I'm getting numbness and I'm getting,
Yeah.
you know, all these symptoms. And so I want to start at a very basic level here. Let's go through your spine and just make sure it all works.
Yeah.
So I want to go through your spine and find all the understressed areas and get them working better.
Yeah.
Now those understressed areas, because they're not being stressed out, they're not injured because they don't work.
I had no feeling in my chin, like all the feelings got after
that
this
from your neck
from the jaw surgery.
Okay.
So all that feeling's gone. So when I do, I'm just like,
How long has that been? How long is it this?
Oh, that since 2015. It never came back.
And that was a result from one of the accidents, the surgery on the jaw?
Yeah, I had to have, so it was like a slow degrading. So it's like if your knee, you don't blow it out all at once, but it just slowly, like the disc got pushed forward and forward and forward until it was pretty much bone on bone. And it was, the option was either do a disc replacement or to do a full orthognathic procedure. And so that's why sometimes I even still have like a bit of a slur,
I understand.
and it'll sound like my mouth is like really pushed together.
The sensation of your face is trigeminal nerve. It comes out
And
right here.
And so I reject.
was-
So 1 in 1,000 chance I rejected the lower left plate.
Uh-huh.
So they had to go back in, and that's right along the trigeminal nerve. And after that is when that
Yeah,
feeling
got
never
damaged.
came
Yeah,
back.
they damaged it.
Yeah.
Oh my gosh.
All right. So
Yeah, it
you
was.
know,
Yeah, that was. It was really bad.
no spinal surgeries. Just the jaw. Any other surgeries?
No, I have had radio frequency ablation on the neck.
Yes.
But I've had like 2 of those.
All of your systems of your body are controlled by your brain through 2 systems,
Yeah.
your sympathetic and parasympathetic. Your
Yeah.
sympathetic system is under assault right now.
Exactly.
We need to clean it. Stress, worry shuts down the parasympathetic. So
Yeah.
both are being involved here, and the health of you as a person is going to be.
No,
being
I
assaulted
know.
here.
It's at the end of the day, it's like, you know,
Mercy.
you go, it's not fun to say it, but it's like you go, you're not going to live a long
In
life.
place, turn your head left, right. Just show me a good center, wherever you think center is. I'm just going to look at you. You're fine. All right.
Do you want me to take
You're
my
fine.
sweatshirt
You're
off?
fine. You're fine. You're fine where you are. You're good. Left hip. Okay. Just looking at you. You're dealing with about 1.5 to 2 inches forward your head. So the more forward your head goes, the constant tension,
and
inflammation.
it feels like that.
When you bring your arm back, this channel gets pinched. That's
Oh,
part
yeah.
of what. It's why your shoulder wants to go forward, and that's why you were saying, Ed, when I bring my arm back, this.
Oh yeah, and I can feel it pinch right there.
We gotta clean that tissue back there so
Yeah.
that it's not so bottlenecked that when you bring your arm back that you're immediately pinching something.
Yeah,
Not nerve ablations.
yeah,
Let's clean the tissue. By going in there and even doing that, it's like moving the bees around. The bees
Yeah.
aren't gonna respond well to being prodded.
This has been kind of more recent when I like itch my head.
Yes.
There'll be pain that'll go down to my jaw. So it's like, and then sometimes I'll start doing it and I'll do it too long and then it'll kind of start triggering the migraine. But it's like, yeah, like I don't know what's going on with my head, that there's like,
So the sensation of the top of your head comes from nerves from your upper neck.
yeah,
The tract of the nerves that go to your face, called the trigeminal thalamic tract, goes down your spinal cord. In the simplest terms, the nerves that give you pain sensation from the top of your head, or even what you're stimulating when you itch your head, overlap with some of the nerves that go to your face
Yeah.
in the spinal cord. There are tubes or tracts in your spinal cord that are in close proximity. So when one tract is being electrically activated, some of that electricity jumps to the other tract. That's why you're feeling it.
and that's what makes sense of why if I hit here or hit right here, like those spots, like
Right.
it's like on both sides
Yes.
too. Like that radiates into the jaw, into the head, and then this will even go like down into the shoulder.
It's due to the tracts in your spinal
Yeah.
cord being so inflamed.
Yeah.
We have got to deal
No, I
and
have a
start.
ton of inflammation. Like I take a ton of not anti-inflammatory.
understand.
It's not like not Advil, but vitamins that help.
Right, I
with
understand.
inflammation.
If I get punched in my face swells up. It doesn't matter how much anti-inflammatory I take. If I keep getting
Yeah.
decked in the face, my face will be perpetually swollen. We
Yeah.
have to stop the punching.
Well, and my face feels like it's perpetually swollen.
Swollen, right. if we stop the assault, the inflammation will go away.
Yeah.
Then the supplements can help clear you,
Yeah.
but we have to start at the postural level
No,
first
that
and
would
spinal.
be great.
Let me start you back for me. Let all the air out. Here we go. Deep breath in for me. Head back for me. Exhale. There we go. Deep breath in for me. Chin down, and then let all the air out. Chin down, exhale. Oh, I know, yeah, you got it. Yeah, tight. You okay?
Yeah.
Let's go on your side facing me. This arm back for me. Put this arm on top of you. Take a deep breath in for me. And then exhale, twist. Exhale, look over this shoulder. On the side for me, good. Sometimes chiropractors bring the knee up real high. The issue is I don't want this to be flattened out. I want the curve. I can tell you've been positioned where like you're used to a certain way. I'm like, no, we're dancing a little different today. I want the arch in your back. It doesn't make as loud of pop, and so everybody cares about the pops, but I care about putting your spine back in the right position, which is this lumbar lordosis. Take a deep breath in, exhale. Let's go face that for me. There we go. Yeah, we got to get the weight back onto the joints. We got to get the curve, the lordosis back into your neck. The entire spinal column is held taut, or we call tethered, when the curve is not in your neck, when the alignment isn't correct, when your head's forward, and like when you were saying earlier, putting your mascara on that you're making your head even farther forward, which is tethering the nerves more. The spinal cord is so inflamed it can't handle any extra tethering. Wow, it just big old lump right there.
Yeah.
I mean, that's just crunchy city.
And it's constantly there.
Well, this can't go away if we don't get the arch back in your neck. You okay?
Yeah.
All right, I'm gonna keep going deeper until you tell me.
No, this is super, super helpful.
All right, get it. There we go.
Yeah, it's like all the way up in like the back of my head.
Mm-hmm. I feel it all. This is all really blown out in here.
Yeah.
Mm. To me, you're a miracle walking. Something worse hasn't happened to you.
Yeah.
Your body shows you how resilient you are, and your body is to surviving what you've been through and the treatments you've been through. That that you're even able to just walk in here. Geez.
I know. A lot of people, and that's what's frustrating is that people constantly go, "Well, if I go to the hospital, they go, well, you look fine," and it's like because I don't have a big scar, and it's like. It's just like, well, yeah, I look fine, but doesn't mean that the inside me doesn't feel.
No,
like
I can
I'm
feel
dying.
it. I feel it on the inside.
Yeah.
I feel it. It's not fine. Right there, it's all congested and clogged.
Yep. Yeah, this side's been a bit worse lately.
You can feel multiple.
Yeah.
It's not just one tear.
I'm feeling some more pain on the right side than there was initially.
I am moving all sorts of
Yeah,
piano keys around here. I'm putting the weight on the structures that you've been avoiding that have a lot of feeling, but we have to do it to take the stress off your discs.
Yeah, I feel
so.
Like
This is, like I said, even
it's gonna jump around.
We're going to.
Yeah.
I can't imagine this. I can't imagine your spine's gonna like me for a handful of visits. You understand? Because I'm caring for you from a position of you want to be healed to 100 or 90.
Yeah.
You understand? Most doctors have been caring for you from the position of let's get you to survive the next 5 years.
Yeah.
You understand? The first disc is below C2, and I doubt that there's any disc injury up here. I bet you it's all because there's numbness in the hands. That comes from this lower cervical.
Well, yeah, but he was saying the pain that like radiates up to my jaw. And just some of what I'm feeling back here is that it was probably caused by C1.
Well, there's no disc up there. My point is that it's just joint inflammation up there then.
Oh god.
So the first disc is below the second vertebrae, and that area gets clogged, congested, inflamed, but there's nothing that really wears out or anything they really operate on.
Yeah,
It's
no,
really just,
no, that's what
yeah.
he was.
Yeah.
Yeah, that's essentially what he was saying.
Yeah, it just is a
He was saying that there's
clogged
nothing
area.
you can do up
Right.
there other than like the.
Clean it. Yeah.
Oh, when you go to that front side,
bad. It's
yeah,
bad.
that alleviates a lot of it.
Oh my gosh.
So that feels good.
Yeah, that
Yeah.
no,
Oh,
I feel
okay,
it.
right.
It's like that good pain.
Yeah.
Yeah, that's getting it. Ah.
It's just so restricted right here. Yeah, I mean, the
It
joint
is.
doesn't want to bend at all.
Yeah, I can feel the pain going away as you're like, you know, doing the soft tissue work.
So there's a neck dental, and it has limited effectiveness when it's this rigid. We're going to try to do it at the end of the visit. I feel that you need this. Like, I got a really strong hand, and my hands hurt right now. There is
That's what
so
every massage therapist says.
your neck so wants to be here,
Yeah.
and I'm asking your neck to be curved. That's why it's so inflamed. That's why it's so tight. It's why it's so RSD and inflamed and nerve. All of
Yeah.
that is because the
Oh.
alignment. I know.
No, that felt really good. Whatever you.
Like,
I know this is why my husband, whenever he, I ask him to massage my neck, he's always like, "No, it hurts my fingers," because he's like, "I can never
right.
push hard
Well,
enough."
it's this. He will be able to. What happens is we're going to make your neck more pliable, and then it
Yeah.
won't. Like, this side's not nearly as bad. Feel the difference? Like, my thumb doesn't hurt much
Yeah.
on this side. This side.
It's funny because this is the side that the shoulder has been hurting more.
Because you're abusing the left.
recently.
The left actually
Yeah.
functions. It's abused over here. The right's stuck.
Yeah.
So it's right.
Well, and it's, you know what, you're right though. It's like I've been feeling the pain more over here recently, but you're right. This right side is where I'd
Frozen.
always get pain,
Right.
in the back here, and then it would go up.
Yes.
So right above my jaw, and it's like that's the like nightmares. Wait.
Yes.
Like that's the pain I still have nightmares about. I
Oh,
literally
that
have
is
PTSD because of it.
Look at that knot there. Gee. Oh man. Like I said, this is rounds of WD-40 scrubbing,
Yeah.
you know, and then letting it soak for a day, and then we have to start aiming your spine onto that neck dental. That's
Yeah.
where we have to. That's the closest emulation I have to me, and that you can use at home. And then they make a thing called a dental pillow. Maybe I'll show it to you in the visit. You know, it's a way
Yeah.
to sleep on a device that gives you some good support in your neck. And
Yeah, I need to find a better pillow because the one I told you I'm using a rolled up t-shirt.
We'll show you at the end. I'll show you. All right. My goodness. I mean, just general palpation here. Feel these ribs are down here,
Yeah,
right? And then this whole left side.
yeah,
So if it's not scoliosis, because the scoliosis always goes to the right. This is injury over here, and then
Yeah.
your whole rib cage is actually just popped up and blown out over here.
as soon as I got rear-ended the second time in August of 2016. That's when that started hurting.
So
And then the third accident that happened in December 2016 just it just made
coup de grace,
everything-
right, just
oh,
pushing
it just
all-
made everything worse. But that was like a car went
Right.
in front of me, and so that I couldn't avoid them.
car accidents take whatever parts of your back that are moving and further
Yeah.
punches them in the face. So there's been no interest or care to me aimed at putting your spine in a more stable position, which then
Yeah.
allows your whole spine to work as a team so that, heaven forbid, you have a car accident, but at least your whole spine participated, right?
Yeah.
Every car accident, you've lost more and more members of your team to now that you're actually on the skeleton crew runs the show around here, and they've had enough for a long time, and now there's nobody left to actually
Yeah, pretty much.
run the show. And so we've got to go through and remind and force the young parts of your spine to get back to work.
Yeah.
And they're not going to just embrace me with open arms and go, "Oh, thank you, doctor." They're gonna be resistant to it. they're gonna want to.
Well, my brain is telling you thank you.
Oh, thank you. Yeah, I understand. No, but these, like right in here, oh my goodness, it's just.
Yeah.
You are my definition for the health of your spine is your health, and therefore, because your health of your spine has been under assault, I hurt everywhere.
Yeah.
My organs aren't working.
Yeah.
You are my poster child and my definition of this. And right there.
Oh, yeah. Oh.
This is supposed to be the main engine of your lower back. So this is supposed to function first, and then your lower back functions last. So this area being resistant gives a good, impression or possibility that your lower back is overstressed because what's supposed to be running the show up here isn't working.
Oh, yeah.
They're starting to go down. It's actually
I just felt that too.
It's moving down. It doesn't want to be there. It just. Yeah, you must soak. I mean, if you need to do a couple of salt baths, but we're going to stir up a lot of stuff in here, and tomorrow morning's when you get your report card for today's session. And I'm gonna keep going deeper until you tell me to back off. Okay, here we go.
Yeah.
All right.
Yeah, I just feel that go out to my head.
So why does that pressure there go up to her head? Is that what she's saying?
Her whole spinal column is being tethered. It's due to the tethering. We're just the fact that we're untethering it is moving nerves in her neck, right? So, they're supposed to be moving independently, but your whole spine is working as one like paddle, and so you don't have independent motion in here. There we go.
Am I bruising from this?
Not yet, but
Okay.
you're going. I can't imagine it's not going to. It's right here. It's all filled up.
Alright. That's fine.
It's gonna.
You're red.
Yeah.
Really red.
No, I was just wondering. Make sure I just won't wear any backless.
That's right. That's right. No backless dresses. That's right.
Yeah. I feel so good. Yeah, that goes up into my jaw. Too.
Wow. Look at that crunch right there.
Yeah. Oh.
This is that channel that she's pinching when she brings her arm back. This is nerves going through here.
Oh yeah, right there. That goes up into my jaw too.
Mm-hmm.
Oh. Yeah. Oh.
Hmm.
Yep, that's the spot. That wraps around my areas.
You're getting really purple right there.
Yeah. Cause yeah, I really don't usually get piezo here.
Mm-hmm. Yeah, the nerves aren't going to be happy if the very first thing they, get punched in the face right as they exit the spinal column.
Yeah.
All this tension and inflammation along your spinal column just assaults them.
Oh. Oh wow. Yeah, when you're like down in there, that's, I've never felt that one before.
Gnarly, yeah. Mm-hmm.
Oh. So you think that the pain I get in my hip flexors is caused by my lower back or my
We got a
mid
lot
back?
going on in your lower back. Yes, I wouldn't make everything in your legs, in your arms, originates in your spinal column.
Yeah.
There is your forward head posture, what feels like no curve in your lower back. The loss of these curves is going to tether the nerves, which then makes the sensation down your limbs
Yeah.
painful. We got to get the curve back in your spine. Even when you were filling out paperwork, I know you help prop up but I'm saying your back desires to have your knees on your chest.
Yeah.
You understand? That's like
Yeah.
a go-to, and that's sending you down the river. We're going to get worse and worse the more. And I don't blame you for wanting to do it. It puts the pressure on the disc. It takes the weight off the joint and opens up the nerve hole. But we're going to get sunk. It's a dead end road.
So I should perch.
That's right. We should. It helps
Oh
me.
my gosh, that.
Mm-hmm.
Oh. Oh wow, that goes through my whole glute, my whole leg.
Mm-hmm.
Oh. Oh.
We're going to bow you in a second. Deep breath in for me. Exhale for me. Okay, I got you. Very good. Yeah. I know. Your body's used to being bent forward, and we got to bend you back.
Yeah. Oh,
I know.
no, that feels a lot better now. Oh. Yeah, it's like there, and it'll go like under the armpit too.
Mhm.
Oh. Oh. Yeah, like I mean, I've gone to a ton of chiropractors over the years. I just have never found. I mean, other than you guys, I've never found any that
What's really
I
work on
felt.
it.
Yeah.
Mhm.
I felt like God, did the soft tissue work, and it's like I felt like I needed much more intensive chiropractic.
It was all pouring out of here. Wow, yeah.
Oh, it definitely feels better, but I can still feel like a pinch that goes up into here.
That has to do with the discs in the neck. When you're pinching things, it's because of the nerves. When you bring your shoulder back, you're compressing all that
Yeah.
muck on the backside gets squeezed. That's all got to be Epsom salt and cleaned. We stirred it up today, and then we got to kind of draw it out through the salt, or into your bloodstream, and you pee it out. That's the way it leaves your body.
Oh, yeah, like right. Oh gosh.
What's the scar
I
here?
feel-
What's that scar from?
Oh, that's from I had a port from having to get ketamine infusions. All my veins got blown out, so I had a port for
Who knows what the scar tissue inside from that? But they did the muscles in here, and
yeah. My hip flexors do still feel like
tell me what you're feeling.
they feel stuck.
All right, so do your butterfly stretch. Let me show me. Oh,
Like they feel, yeah.
you gotta work on this. So you
Yeah.
must bring your knees together. Sort of try to squeeze your knees together. Squeeze and resist you as hard as you can. Squeeze as hard as you can, and relax now. You gotta work on getting your knees to the floor. Your hips are internally rotated. You gotta, like I said, externally rotate them and get the. You gotta work on this.
Yeah.
Sitting turns our hips inward. We
Yeah.
have to. That's where squeeze. 1, 2, hard as you can. 3, relax. Good. The frog pose on the stomach does it too. You're face
Yeah.
down. That's what I want you working on. But so much of what you're even feeling in your legs right now is all this.
Yeah.
Right. So we got to get you on that lumbar dental. This is what we're.
No, yeah, it looks like I got a whole new tattoo. It just kind of frames it.
But
Yeah.
it's all. I got to clear all this out. Even
Yeah.
these channels in your neck here. There's all this inflammation up here that we got to
Yeah.
clear out.
Yeah, and that's been worked
Yeah.
on.
Yeah.
So it's like
Right, you seem
perfect
to-
to see
right.
to see how
That's
much
been worked on. Yeah.
inflammation and for
Mhm.
that having been worked on so much.
What hasn't
And
been.
then it's like what hasn't been, yeah, you can see the massive difference. Yeah. Like honestly it's like almost it's darker than the heart. Yeah. That's wild.
All right. Tilt your head to the right for me a little bit. Tilt your head right. If you can, a little bit more right. There you go.
Oh, that felt good.
Go ahead and tilt your head to the right for me. Tilt your head right. Okay. All right. Go ahead and tilt your head to the left for me.
Oh.
There we go. Tilt your head left. Okay, it's okay. Yeah, you needed those two. Wow.
Yeah.
Clogged. I know it isn't comfortable there, but we have to.
No. That's
That's
it
where you
has
want
to
it.
be there.
Yes.
I can't put it up.
I don't want your chin down. I want your chin up. I
Alright.
know. The curve in your neck has to be. We have to aim you. Your default is chin down. That's
Yeah.
why all that tightness is up
Well,
there.
my default's like right
I know,
here.
but you see how your chin's down?
Yeah.
You need to have your chin up. Get the idea? Now, if it's too much, let me know and we'll get you off. I'm just saying, you might not be ready to, we need to spend another 3 hours, 2-3 hours cleaning that so this can take it from there.
Yeah, it's
Too much?
like it is a bit. It's like right
Too
here.
intense?
Right here, it's really nice. Like this is a nice spot.
I know, it's not.
Can I mean, can I sleep like that?
No.
Or no? What would be okay? So what's the best in
Well,
between?
we got the best in between is just letting the next option would be to just let your head gently dangle over the edge of the bed. See, we want extension traction. Just straight traction is going to be another dead end road. I think a lot of what you're feeling even right now is that we got to spend more time on your neck.
Yeah.
You're
I
not
agree.
ready. The den rolls I generally introduce to patients on visit like 3 to 5. You understand?
Oh.
We're jumping the gun here. I wanted to test you out here,
Okay.
but let me show you the den roll pillow here and see
Okay.
how you do on this guy. This is. And we'll just test out. There's a mini version of that in here. I'm curious to see how you do just on the pillow first. Just curious how that.
Oh no, that's nice.
Yeah, this
See,
is where
that's a lot better.
that's where your neck belongs. Now,
Yeah.
if you wanted to stretch a little bit, the pillow has the ability to lift your head a little bit. You can open up the middle part here, and then there's like a little hole for your head to go into. Now, if you want to stretch, now your head can sink in.
Oh, that's so nice.
That lets your
Okay.
head sink into it.
Yeah, can I buy this?
Yes.
Yes. That feels a lot more open than it did before. When I go like right here, I can
Good.
feel there's like,
I want
alleviate the.
Your first goal is 20 minutes. Your first goal is to survive time on this, and then we can worry about taking these books out and trying to go deeper in the stretches. Now, again,
There's books here.
there's 2. Yeah, I got 2
Okay,
yoga blocks.
okay.
Eventually, your head will be on the floor, but my worry is that you're going to do too much bending with your neck.
That would definitely.
So that's why we have to have these books. Go on Amazon,
Yeah.
they sell yoga blocks.
Yeah.
Get a roller. Go ahead and roll upwards a little bit, so roll towards me. There you go. There you go. Get the idea, and we're going to keep, and then stay right there. About every minute, you move 1 inch, kind of idea. Bend
Yeah.
the knees a little bit more, and then keep the knees together and feet together, and then rotate your knees left. There you go. Breathe. Exhale. Good. Stretch. Good. Knees back up. Let's go knees to the right. About 5-10 seconds. There you go, each way. And then for the most part, your knees will stay in the middle. But yeah, is that as far as
See,
you
when I
go?
go there, that actually pulls
Pulls.
the shoulder.
Yeah. It's what's happening is you're recruiting your upper back to help you turn your chest.
Yeah.
Right? We're trying to make your lower back do it, but your chest is, doing the motion. So bring knees back up and keep these middle. And then you move down 1 inch. So then try to push. There you go. And then stay right there. And then do the same thing again. Do knees left. There you go. Start with the foam roller. Obviously, you got your neck down roll pillow.
Yeah. I'll
and then
definitely
we'll-
get the pillow.
We'll figure out another time to get in here and.
Yeah, for sure. Thank
Go
you
from
so
there.
much.
All right.
Yeah, and hopefully, with the campaign going on, I guarantee the opponent will see the stuff on my back and put out a mean mailer that'll say, "Oh, Michelle's husband beat her" or something.
Aw, well, good.
Yeah. So it's like make it clear that is not what happened. Yeah, that politics is a dirty game. Seriously, don't get into it.
Aw.